Ever wondered why you would need a bougie? Let's dive into the world of medical procedures, where tools like the bougie play a pivotal role. Born in the realm of healthcare, the bougie came into existence as a slender, flexible instrument to assist in difficult intubation. Now you might be thinking, what exactly is intubation? Well, it's a procedure often used in medical emergencies to assist with breathing, and the bougie is a crucial player in this field. Its significance? It's all about guiding the endotracheal tube into the right place, ensuring that airways remain open and oxygen keeps flowing. A life-saving procedure becomes a whole lot safer and more efficient with a bougie in skilled hands. So, whether you're a seasoned health professional or a curious onlooker, the bougie's role in healthcare is something worth knowing. In the next few minutes, you'll understand exactly why a bougie is a crucial tool in healthcare. Knowing when to use a bougie can make all the difference. A bougie, for those unfamiliar, is a thin, slightly flexible device that assists in the placement of a tube in the airway during intubation procedures. But when exactly should this tool come into play? Typically, a bougie comes into use in challenging airway management situations. Picture this. You're dealing with a patient who has a difficult airway. This could be due to several reasons, such as anatomical abnormalities, obesity, or trauma. Traditional laryngoscopy might prove challenging in these scenarios, and this is where a bougie steps in to save the day. The bougie, with its slim design, can navigate the tricky anatomy of a difficult airway with relative ease. It serves as a guide or a pathfinder, if you will, for the endotracheal tube to follow safely into the trachea. This makes the bougie a go-to tool for difficult airway management. There's another scenario where a bougie comes in handy. Imagine an emergency situation where intubation must be performed quickly, and there's no room for error. In such a high-stakes situation, the bougie can provide that extra level of assurance, improving the success rate of first-pass intubation. The bougie's utility doesn't stop there. It's also beneficial in planned intubations where the patient's airway is predicted to be difficult. A bougie can be used as a proactive measure, helping to prevent complications and ensuring a smoother intubation process. Now, it's important to note that while a bougie is indeed a powerful tool, it's not a one-size-fits-all solution. It's a part of a bigger toolkit that healthcare professionals have at their disposal. Its usage should be based on a comprehensive assessment of the patient and the situation at hand. So, it's clear that the bougie isn't just a random tool, but a vital instrument in certain medical scenarios. Knowing when to deploy a bougie can certainly make the difference between a successful or a complicated intubation. And remember, the goal isn't just to get the tube in, it's to do it safely, effectively, and with the least amount of stress on the patient. Before we dive into the process, let's understand the equipment involved. At the heart of this procedure, we have the bougie, a slender, flexible instrument that guides the endotracheal tube into the trachea. Its tapered end and malleability make it an excellent tool for difficult airway management. Next up is the laryngoscope. This device illuminates and exposes the larynx, providing a clear view for successful intubation. It's essential to have a good grip on the laryngoscope's handle as it gives control over the tongue and soft tissues of the mouth, paving the way for the bougie. Last but not least, we have the endotracheal tube. This is the final destination for our bougie guide. It's a hollow tube that enters the trachea to maintain an open airway, essential for ventilation and oxygenation during surgery or in cases of respiratory failure. Now that we know our tools, we can move on to the step-by-step process. Intubating with a bougie is a process that requires skill and precision. It involves a series of steps that need to be performed with utmost care to ensure the procedure is successful and safe for the patient. Let's delve into it. The first step is patient positioning and preparation. Positioning the patient correctly is crucial to ensure the best possible conditions for successful intubation. The patient should be placed in the sniffing position, with the neck flexed and the head extended. This position aligns the oral, pharyngeal, and laryngeal axes, making visualization of the larynx easier. Once the patient is positioned appropriately, administer sedatives and paralytics to facilitate the procedure and decrease discomfort. Moving on to the second step, the laryngoscope insertion. Choose the correct size of the laryngoscope blade, either a Macintosh or a Miller, based on the patient's size and anatomy. Hold the laryngoscope in your left hand and insert it into the right side of the patient's mouth, moving the tongue to the left. Advance the laryngoscope until the tip is in the vallecula, then lift upwards and forwards, not backwards, to visualize the larynx. Remember, the goal is to see the laryngeal inlet, not to pry the jaw open. Now let's talk about the third step, the bougie insertion. The bougie, a thin, flexible, and rigid rod, is an invaluable tool in difficult intubation scenarios. Hold the bougie in your dominant hand and introduce it into the mouth, aiming for the laryngeal inlet that you visualized with the laryngoscope. The bougie should be inserted with the coud tip or the bent end facing anteriorly. As you advance the bougie, you may feel a series of clicks or bumps. These are the tracheal rings, and feeling these confirms that the bougie is in the trachea and not the esophagus. If you feel a single large bump, that's likely the carina, and you've gone too far. Withdraw the bougie slightly until you're back in the sweet spot. The fourth step is the endotracheal tube insertion over the bougie. Once the bougie is in place, take the endotracheal tube in your right hand and slide it over the bougie and into the trachea. The tube should pass smoothly over the bougie and through the vocal cords. If you encounter resistance, do not force the tube. Instead, withdraw slightly, adjust the angle, and try again. Once the tube is in place, inflate the cuff to secure it. The final step is the removal of the bougie. Once the endotracheal tube is properly placed and the cuff is inflated, it's time to remove the bougie. Grasp the end of the bougie and withdraw it smoothly from the endotracheal tube. Be careful not to dislodge the tube during this process. Confirm the tube's placement by auscultating bilateral breath sounds and checking for end-tidal CO2. And there you have it, a step-by-step guide to intubating with a bougie. This procedure, while complex, can be a life-saving skill in difficult airway scenarios. With proper technique and practice, you can master the art of intubation with a bougie, enhancing your clinical acumen and patient care. Let's recap the key points about intubating with a bougie. We've covered quite a bit of ground here, so let's take a moment to consolidate all that information. Firstly, knowing when to use a bougie is of paramount importance. It's a crucial tool in your arsenal as a healthcare professional, especially when dealing with difficult airways. Challenges in airway management might arise due to various factors such as anatomical abnormalities, obesity, or trauma. In such instances, a bougie can be a lifesaver, quite literally. Then we moved on to the equipment. The bougie, a slim, flexible, and reusable introducer, is your primary tool here. It's designed to facilitate the placement of an endotracheal tube in the trachea, especially when visualization of the larynx is inadequate. Besides the bougie, you'll also require a laryngoscope and an endotracheal tube. Remember, it's crucial to ensure all your equipment is well maintained and ready to use when the need arises. Next, we delved into the step-by-step process of intubating with a bougie. From positioning the patient correctly to inserting the bougie, every step is vital for a successful intubation. We also touched upon the hold-up sign, a tactile feedback that indicates the bougie has entered the trachea and not the esophagus. Following this, the endotracheal tube can be railroaded over the bougie and into the trachea. But remember, practice is key. The more you familiarize yourself with these steps, the more proficient you'll become. It's also important to stay calm and focused during the process. Your patient's life might depend on it. In conclusion, the bougie is an invaluable tool in airway management. It's a practical, cost-effective, and life-saving solution to difficult intubations. By mastering the use of a bougie, you can effectively manage challenging situations and significantly improve patient outcomes. Remember, mastery of these steps can make a significant difference in patient outcomes. Thanks for watching and stay tuned for more healthcare insights.